General Hospital, Taiwan. It's my honor and pleasure to be invited to participate in the 2021 ISOPES Symposium and to be as a speaker for this session. Today, I'm very delighted to have this opportunity to present a topic about the status of minimally invasive surgery in Taiwan. I have no conflicts of interest to disclose. Minimally invasive endocrine surgery includes the surgery to endocrine tumors. This presentation will take thyroid surgery as an example to illustrate the minimally invasive surgery in Taiwan. I'll cover the following context. First of all, the development of thyroid surgery will be introduced. Secondly, I will talk about the application of minimally invasive thyroid surgery and the remote access thyroidectomy in Taiwan. Finally, transoral thyroidectomy in Taiwan will be described. The Nobel Prize winner, Theodore Coker, developed the transverse incision to remove the thyroid. He efficaciously decreased the surgical mortality and morbidity. The transverse incision was still used till now in conventional thyroidectomy. However, the neck incision wound is annoying and bothersome to some patients, especially if there is formation of keloid tissue. Wearing a choker or scarf can cover the incision scar, but it may be odd in some circumstances. Hereafter, many different ways of thyroid surgery have been developed. They can be divided into two categories. One is in minimal invasive thyroidectomy. The other group is remote access thyroidectomy. The Professor Miccoli in Pisa, Italy, published his first minimal invasive video-assisted thyroidectomy in 1998. Nowadays, the MIVAD is a worldwide surgical method. It has been used in more than 100 centers from 35 countries. In our hospital, we have done many MIVAD procedures. We use the specific instrument for MIVAD. In recent years, we use the energy device instead of bipolar cautery. After the operation, most patients have small incisions and good cosmetic results. However, some patients develop obvious keloid tissue. For the retraction difficulty of MIVAD, Dr. Yang designed a special retractor, modified army retractor with mosaic ring. The mosaic ring is for the implantation of endoscopic camera. With the use of specific retractor, the operating time can be decreased from 120 minutes to about 60 minutes. As a result published by Professor Miccoli, Dr. Yang also found there was lower thyroglobulin in MIVAD patients comparing with patients receiving conventional surgery. There are several kinds of approaches in endoscopic thyroidectomy. It can be approached from neck, from chest, axillary, and the breast area. Robot-assisted thyroidectomy transaxillary approach is developed by Professor Chong in Seoul, Korea. Professor Chong has published the safety and the good cosmetic results in this surgical method. The jaw retractor is always necessary for better retraction in transaxillary thyroidectomy. For better retraction, Dr. Yang in Taiwan designed another Yang retractor. Using the special equipment, it is reported that incision wound can be shorter to 4 cm in length. The Yang retractor can also be used in fast-lift thyroidectomy. Robotic-assisted bilateral axillary breast approach (BABA) is advanced by Professor Yong. In Seoul, Korea, Professor Yong has also published the safety and good cosmetic results in this kind of surgery. In BABA surgery, the most concerned problem includes widely dissection area is necessary. It will induce ecchymosis formation, and this is time-consuming to build. Dr. Liang in Taiwan used single biaxial tunnel technique to decrease the dissection area. He used the vascular tunnel from one side to the other side, and the limited dissection is necessary. Using the vascular tunnel method, there will no bleeding or infection occur in the patient receiving BABA procedure. Remove excess thyroid surgery is sometimes criticized whether it belongs to minimal invasive surgery. Although remote excess surgery brings the patient scarlet neck, extensive dissection will bring the patient discomfort for a long time and has a higher incidence of bleeding. Besides, it takes a longer operation time and a longer learning curve. Transoral endoscopy thyroidectomy vestibular approach is one of nose surgery. It is developed by Professor Annie Wang and reported in 2016. From 2016 to 2018, the surgical indication for TOVA has increased and the exclusion criteria decreased. The surgery can be done when thyroid benign or follicular neoplasia is smaller than 6 cm and the thyroid cancer tumor is less than 2 cm. At present, the TOVA surgery has been widespread globally. It is considered it just needs more limited dissection than other remote access methods, and the learning curve is shorter. The following is our TOVA experience in Taiwan. In the beginning of TOVA development in Taiwan, our Taiwan endocrine surgeon traveled to Bangkok to observe the transoral thyroid surgery by Professor Annie Wang and attend an international workshop for TOVA procedures. Nowadays, there is transoral endocrine thyroidectomy workshop almost every year in Taiwan. It had ever been held by Taiwan Association of Endocrine Surgeons, IRCA Taiwan, Jui-Yu Hospital, and many endocrine surgeons perform transoral thyroid surgery in selected patients. We designed special jabs for TOVA procedure. In TOVA process, it is sometimes difficult to hold the endoscopic camera by first assistant. Camera holder can facilitate the transoral surgery and even do the operation alone without experienced assistant. The creation of subplatysmal space plays a key role in TOVA surgery. Dr. Liang selects a 18 French Foley catheter and insufflates the balloon after the balloon tip was brought into the sternal notch. After the using of Foley balloons, wider subplatysmal space was built with good hemostasis. It can facilitate the implantation of bilateral trocar. Professor Wen applied continuous nerve monitor in transoral thyroid surgery. After the exploration of cartilages, the vagus nerve was identified and the nerve monitor electrode was placed. Continuous nerve monitor can early detect adverse EMG change and then prevent recurring laryngeal nerve injury. With the use of continuous nerve monitor, no recurrent laryngeal nerve was noticed, transient or permanent palsy. Transoral robotic thyroidectomy in Taiwan is performed by 3-point or 4-point method, depends on what the surgeon's choice. Dr. Chen in Taiwan using 4-pore method in chest oral robotic thyroidectomy. According to his experience, the learning curve in total is 44 patients. Because of the high cost in chest oral robotic thyroidectomy, we utilize the 3D endoscope camera in TOVA surgery recently. The patient receiving TOVA usually has good cosmetic results. There are no scars on neck. However, there are some concerns of safety should be noticed while we do the chest oral thyroid surgery. From the surgical outcome reported by Professor Wang in 2018, several complications may occur in TOVA procedure, especially for the recurrent laryngeal nerve injury and the hypoparathyroidism. There are some special events such as mental nerve injury and the possible infection should be noticed. Dr. G reported his TOVA procedure in 2018, and the fragile tumor specimen was found if the tumor size is larger than 2 cm. Therefore, bigger cancer tumor is not recommended in TOVA procedures. Chest oral approach has made the surgical wound classification from the clean wound to the clean contaminated wound. In Dr. Chen's study, the reports in oral bacterial culture revealed there were only 14% patients had slowly growing anaerobic bacteria. After the use of antibiotics and oral hygiene, there were reported very low infection rate in previous publication. In TOVA procedure, the insertion of endoscopic trocar is possible to injure the mental nerve. If the damage occurs, it will induce the numb chin syndrome and annoying the patient for a long time. In our hospital, we use the 3D printing technology to build up a patient-specific safety device to prevent the mental nerve injury. After the CT scanning, the 3D image reconstruction is developed and a specific safety device is manufactured by the 3D printer. The device is like a dental brace with the designation of bilateral marker. The marker will indicate the location of mental foramen. As the surgical guide, the safety device is applied on the patient's lower teeth. Before the insertion of lateral trocar, the location of trocar incision is recommended 2 cm away from the mental foramen. We have used the safety device since 2017 in our hospital. In our preliminary results, half patient has a diagnosis of nodular goiter, and the mean tumor size is 2.5 cm. The surgical outcome was listed here. There was no patient with mental nerve injury and infection in the use of safety device. The safety device has got a utility model patent of Taiwan in 2018 and Korea in 2021. In conclusion, minimally invasive surgery is feasible in selected patients. Endocrine surgeon can select the appropriate operating method that is competent. Besides, surgeons should balance the safety and the cosmetic effect in different approaches. In the end, I want to wish the success of 2021 ISOPES Symposium and hope the COVID-19 can go away and the in-person conference can be held next year. I appreciate the time you took to listen to the topic and thanks for your attention.
Greetings, dear colleagues. I would like to say hello to the many.
Thank you, Jui-Yu Chen. Is there any question on the floor or online? I'll check. Okay, then.
Thank you, Professor Chen, and congratulations for the developing the special device to reduce the surgical complication for the TUEVA. Is there any special effort and how to get the idea to reduce the complication during the robotic using the BABA or the TUEVA?
You mean in Baba?
Yeah, including the BABA, any other method, including the TUEVA and any other approach. Actually, from your lecture, developing the special device is interesting. How to perform making the device to the device during your operation? Is there any special step to develop the special device to reduce the surgical complication?
Because in minimal invasive surgery, we do the transoral surgery recently, and after the discussion with the 3D printer center, I think the design some kind of safety device to prevent the mental injury. It is very important, so we designed it, and we want to take the device and to routinely use.
It is an individual device per the case by case.
Yeah, because it's the personalized. We use the CT scan, and so we can create a safety device in individualized. So it's the advantage of 3D printing.
Congratulations for your study.